can oral cancer be treated effectively? I mean, cured completely? The answer is yes. So, think of it as, for most people, like it could be a skin cancer. Cancer is cancer, right? So some people think that, well, I have skin cancer and I went to the doctor and they removed a piece of my skin and I'm fine, right? So when you hear the word cancer, so immediately you start to think like, how risky it is. Skin cancers are sometimes are not as risky as any other cancer. Sometimes whenever you talk about cancers, there could be some benign cancer and then some malignant cancer. So the malignant cancer is very serious, whereas some benign cancers, they are not as serious. We talked about the signs of having some cancer. Sometimes I do see patients, they have a small lump in their mouth, and immediately when I see that, patient is not a smoker, patient is not they don't drink, and patient is a very young patient, and they say that, well, when I was chewing and I remember biting my lip, and it's a swelling, and sometimes when you look at it, and it kind of looks benign. And although we always, whenever we remove any type of lump or bump from our body, we always send it for a biopsy, but for a lot of times we are able to reassure the patient just by looking at it. Hey, I don't think it is cancer, but let's get it checked out and let's send it for a biopsy. That's what we normally do. However, the question becomes, whether it can be cured completely. In this case, for example, right? So if it is a benign cancer, then you just by removing it and you're able to cure it completely, and the chances for that to come back is very unlikely. Even if it is a malignant cancer, sometimes if it is a smaller piece, so sometimes you remove it and it is possible that you may be able to cure it completely. Sometimes, depending on the size of the cancer, we take a small sample if we think it is malignant, and we may be able to take a small sample of the tissue, then we send it out, and then when it comes back and if we find out it is a malignant cancer, we are able to remove a bigger piece of it, and then sometimes I see patients, they get no problems at all, and everything is cured completely. Sometimes we see bigger chunks of oral cancer that happen, that sometimes goes into the neck and things like that as well. And we have seen and we have been able to treat patients very effectively, and they got no recurrence whatsoever for the rest of their life. Some people we have seen live for 20, 30, 50, or maybe even 100 years. So to answer your question, is oral cancer curable? Yes, the oral cancer is curable, and there are multiple options available when it comes to treating oral cancer. For example, doing a small biopsy. We call the biopsies as incisional biopsies or excisional biopsies. You got laser treatment, you got radiation, you got some chemotherapy. There are multiple options and to completely cure the oral cancer.